So we are going to now turn this over. Kathy, are you on?
I am on.
Okay, so Kathy, you want to say a little something as well?
Well, actually, Kay, you took some of the words out of my mouth because I was going to say we're very excited to have to be working with the Alliance again, and we've focused a lot in recent years on rapid rehousing, and we want to now focus on just the critical role that emergency shelters play and how they fit into our whole emergency response system. So I'm not going to take up a lot of time. I just want to welcome everybody on the call. And again, we are so excited to be working with the Alliance again. So I'll turn it back to you, Kay.
So lots of excitement. We're all like really, really excited. And, for those of you that, when we talked about rapid rehousing, and we also came and did those system design clinics for you guys probably in 2014, which is now almost 3 years ago. But I don't know if you remember, some of you may remember we talked about that a system, a well-oiled system is not like a clock shop where you guys as all different providers are sitting around the table and you're cooperating together, but you still sort of have your own way of doing things, that you really are one clock. And I don't know if you remember, we talked about everything in the clock is a gear. Each of the elements of a crisis response system are gear, and shelter is one of those critical gears. And so we oiled up the rapid rehousing gear, and now we're oiling up the emergency shelter gear. So, sort of think about that. It reminded me of that when Kathy said, we want to focus on emergency shelter down. It really reminded me that this is like keeping all the gears oiled. And thank you to Virginia, again, for giving support to all of you. We know that a lot of folks in a lot of states don't have the kind of support that you guys get in Virginia, so we're just really glad to see that that's happening. So Christy, I'm going to turn this over to you, and I also have to remember I'm doing the slides. So Christy, you want to talk a little bit about some of the logistics?
Yes, absolutely. Thanks, Kay. Welcome, everyone. It's great to be here today. Just a few housekeeping tips for our webinar. To note that all of your lines are actually on mute right now, and that's just to mitigate any background noise or hold music that might disrupt the webinar today. So in that case, we're going to ask you, if you have questions, which we'll be taking throughout the presentation, to go ahead and pose those questions at any time in the questions box, which is on your navigation panel. You'll see it under polls, dashboard attendees polls, and questions. You can type your questions in there, and we will be able to, we'll answer them, and I'll basically direct those to Kay and others to answer those questions for you before the end of the webinar. Also, just wanted to let you know that the webinar and the slides will be sent to all the learning communities teams following the presentation. So know that that will be coming to you directly, and please feel free to share with these resources with your staff or any other stakeholders. And then just to encourage you to join us on Twitter. We'll be tracking our progress and your progress and our involvement with the Virginia learning communities through the next couple months. And we have added a Twitter handle, Shift Happens, which Kay will explain more throughout the webinar. So join us there and on Facebook. So thank you very much. And again, if you have any questions, feel free to put them in the questions box.
Hey, Christy, I just wanted to make sure, did you start the recording?
I did start the recording.
Perfect. Thank you. Okay. And the next slide is yours too, Christy.
Okay.
Oh, and I have to do it, don't I?
Yes, you do. Yeah,
Here
right,
we
correct.
go.
Super.
Thank you.
Thanks, Kay. So we're going to start off with a quick poll, and I just want to get a sense of who you all are and what your role is in your organization or the COC. So we're going to go ahead and launch that right now. You should see it on your screen. We'll give you a few minutes or a few seconds to fill that out. So we're just trying to get a sense of where you're coming from. And people are answering. Thank you so much. About half of you have voted. Thank you. Great. And we're up to 90% voter participation here. That's great. If you can get up to 100, that'd be awesome. Oh, nice push.
Yeah, she doesn't put any pressure on, does she, guys? Look at this. Here we go.
Oh, we're at over 90%. I'll give you a few more seconds. Okay, we're going to go ahead and close the poll now. Thank you for participating, and I'll share those results in 1 second. And it looks like we've got some COC leadership here. 21% of you are coming from your COC leadership teams. Some executive directors, great. That's exactly who we're looking for to be a part of these conversations. We've got some operation and finance staff, case managers and supervisors and case managers and program administrators. So thank you very much. That gives us a real good sense of how to anticipate questions and to how to gear our presentation. So Kay, I'm going to switch it back to you.
So thank you, and I want to say I'm really excited to see, almost a quarter of you are Continuum of Care leadership, because the link between Continuum of Care leadership and between emergency shelters is just really, really important. And also, happy to see, the on-the-ground case managers, supervisors are on the call as well. So because you guys hit the ground running. So. Again, I think I said this already, but, I've met a lot of you over the past years doing our work to improve and implement best practice around rapid rehousing. And so many of you are familiar with the Alliance and our work, but I know that there may be some new folks and some of, those of you emergency shelters did not perhaps participate. So just to give us you guys a brief overview of our work. So the Alliance is a national organization. We're committed to prevent and end homelessness across the country. We do not work for HUD. I want to make that clear that and we don't get any HUD funding. So we are a nonprofit that works to end homelessness. We certainly do work side by side with them, but I think sometimes people think that we're like a provider of theirs, and we're not. So at the Alliance, one of the main things we do is identify policy solutions, and we promote them to the administration and to Congress and anyone else who will listen. Like, we really try to get the word out across the country and spend a lot of time up in the Hill. And then we have a capacity building team, and that's what Christy and I work on, and we go across the country to communities. We help create better systems, and we also then have our HRI department, Homeless Research Institute, which looks at data and evaluates information to educate opinion leaders about homelessness and housing and solution. But I think one of the most important things is that we really learn from providers in the field, and particularly the work that Christy and I do on the capacity building team, is that while we're working with you, we're going to be learning together. And we've been, working on this emergency shelter initiative for the last couple of years. And so what we're going to be even telling you is slightly different than maybe what we did 2 years ago, because we've learned as we work with people. And working with you guys is just so critical in helping us inform our work to help other folks as well. So I have to tell you, I'm a bit challenged because I am moving my slides and also talking, and for me, I'm sort of like, single focused, and so Christy will hop in if I start talking about something and I haven't switched slides. So if you hear Christy say, "Kay, you need to change your slides," it's because I've forgotten to do that. So our agenda today, we're going to provide an overview of the upcoming learning communities. We're going to be reviewing the 5 key elements of effective emergency shelter and preparation for the upcoming session of the learning community. And we're not going to take a deep dive into these key elements. This is going to really be a high-level overview. And we do want you to send questions in, but if they're like those sort of really deep dive questions, that we won't be covering today, because we're going to use the opportunity when we're there in person to dig deeper. But we just wanted, before you come, to be familiar with these concepts, so you wouldn't be coming in sort of having no idea of the 5 key elements that we were going to be focusing on. So what's an emergency shelter learning community? So the learning community is an opportunity for shelters to learn together in a community of peers. And the goal of this is to really guide the shelter providers and continuum of care leaders to adopt the practice of the policies for, in essence, operating effective emergency shelters. And we want to make sure that it's aligned with the systemic approach to ending homelessness, that we don't have just a lot of sort of call it boutique programs where everybody's doing everything different, which can become very confusing to folks when they're experiencing homelessness and they're in a crisis. So you guys, probably already know this, but you're being grouped according to what region you're in, and in 5 areas throughout the state. And we did that intentionally because we often find that emergency shelter providers feel like they're sort of out there on their own, and they haven't really had the time to meet with a group of other emergency shelter providers and learn together. And we're hoping even when, when we are, sort of come to the end of the learning community, that connection that you have with people in your regions, even if they are big regions, can continue, and that you can continue to stay in touch with each other and learn from each other. So we're really looking at, how you can improve your shelter services and outcomes for your clients. The idea is to exit more people to permanent housing more quickly. That sort of sums up like what the goal of the learning community is. So then you're going to be establishing individual organization goals on how you can do that within your programs. And then, after we do this upcoming session, we're going to be doing trainings, trainings through like remote trainings, through webinars and conference calls to give you a lot of support. Both DHCD and the Alliance will be providing that follow-up support to you. So a little bit about, I already talked a little bit about this, but you've got the 5 learning communities across Virginia. And what we do know when we've done this work is that when a team of staff participate and commit to implementing an action team or an action plan as a team, that we find that a lot more happens. So we're really encouraging you to identify a team of 3 persons, including, if at all possible, the executive director, that would commit to meeting internally at your own shelter weekly just to talk about some shifts that you're going to make. And you've heard that word shift, the hashtag shift happens, and I want to make sure you know there's an F in the word shift, that shift happens, and you're going to hear us talk about how do we make some shifts. And we just know that when it's not like one person that comes and then tries to take it back and educate everybody else on what they've learned, that if a team of 3 people can come hear the same thing, and we also really, while we say in executive directors, we really want to encourage that the decision maker that can really say, yes, we're going to implement this shift, this change, is there so that it's, that things can happen more quickly, and not have to sort of wait like, well, I think I get that, but when I get back, I'm going to have to talk to this person or that person and explain it to them. So just encourage, that the ED or president of your organization, or someone that you sort of, that that leadership empowers to make that decisions, is part of the meeting as well. And then I also want to say that I know some of you might be really small shelters, and you might be like right now going, okay, well, we don't even have 3 people that could come to a meeting because we have to run our shelter and we're really small. And I get that. In some of the work we've been recently doing in Georgia, we have some really, really small shelters, one that only has 2 paid staff, in fact, and use a lot of faith-based folks to volunteer and help them. So what they actually did is brought one of their long-term volunteers with them, and they actually had an intern that was just starting and was going to be spending a full year with them, a social work intern, and so they brought them as part of the team. And they also talked about how valuable it was to have, a couple of other people that were still, rubbing shoulders with the shelter to be part of that. So just, whatever works for you, works for you. And then I already talked about that we're going to be having these monthly follow-up calls with the technical assistance from the Alliance and from DHCD. And also we will have at least 1 webinar, maybe 2, but we're going to talk more about that again when we get together with you guys and find out like what your interests are, what would be the most helpful to you. So the upcoming workshop, so I already said this, we're going to take a deeper dive into the key elements of effective shelter. We're going to have you review your current practice and identify areas that you can start looking at, and then create a short-term action plan to implement some of those changes and improve your practice. But what can you do to prepare? So we'll be sending out an email. If you don't get it by tomorrow, you'll get it by Monday, that will say this is what you bring with you. For those of you that are coming to the Richmond area learning community and the Tidewater area learning community, you will get that in the next day or 2. For those of you that are coming the first week of May, we'll probably won't send that out for another week or so. But just to prepare is that, whatever your most current policies and procedures are, just bring those with you. I know in shelter work that sometimes these things do not get updated very frequently, and you may go, oh my gosh, like I haven't, looked at this for a while. That's okay. Just bring with you what you have. And then, also if you have like a mission statement, just sort of anything that reflects what you your sort of currently operating manual for your organization. And then we know that most shelters have some type of either, resident rules, resident handbooks. Sometimes they're posted in the shelter. Sometimes they're part of an intake package where, residents will sign off on them when they first enter your shelter. Anything you have like that, please bring that with you. And then this last thing, not to panic, we'll talk more about this, is this completed March metrics form, which you have no idea what I'm talking about, but here it is. If you're a shelter that happens to do rapid rehousing and have rapid rehousing funding and also happen to be part of the rapid rehousing learning collaborative that we did, and the difference between a community and collaborative is that the collaborative, there was a lot of pre-work that was done, that shelters, sent in a lot of information in advance and did some work in advance of meeting with their teams, and there was a lot more follow-up that we did. This is it's not as deep as that, but it's still the opportunity to learn in a community. But this metrics may look somewhat familiar to you because there were similar types of things related to looking at rapid rehousing outcomes. But this is what we're going to ask, and we're going to be asking if you can pull this information. And there are some people that just still keep, sort of like while they report all of this stuff in an HMIS system, but we also know if you're a DV shelter that you won't be doing that. And so DV shelters, whatever you do to keep this, but when you get this, there's a much more detailed explanation of how to measure each of these things, but this is the kind of information we're asking. And just to have a baseline, we're going to be asking you to tell us what happened in 2017. Other than the total number of beds, which is at the top, the total beds you have for unaccompanied individuals and the total beds for families. After that, we want you to talk about households. So if you are a shelter that serves families, and maybe and those you had 10 families that made up a total of 33 persons under total unique households served, you would not say it was 33, you would say it was 10. We want this to go by household, not by individuals. Or if you have a couple that you're serving as a household, that would be up here, that would be you'd have 2 beds for them, right, in that first one. But under here, number 2 would be they are a household. And so every question from here on out is talking about households. So we want to make sure that's sometimes a mistake that people make, is that they start reporting on like family numbers as individuals rather than a household. And then, we also, and we just would like you to have this so you sort of have a baseline of what you're thinking about, and then this is one of the things that we'll be talking about throughout the learning community. Okay, so here's the thing. I also have some notes here, and I hadn't done that. So I want to say, before we move on, Christy, have there been any questions that have come in about some of the logistics of the learning community?
Regarding the data, there has been one question. The question is, if we are a COC lead agency, should we pull info for the system as a whole? We have individual shelter providers coming as well.
So that's a great question. So we want each individual provider to provide their own individual shelter stuff, because that's what they're going to take to sort of look at their goals, right? Like, what are they doing individually? But yes, if you're coming as a Continuum of Care lead and you've got it as a whole, that would be great. That just sort of adds that extra element, like this is where we were in March as a whole, but then here's, if each individual agency can sort of see that, and that will be, again, you're not going to share that with the whole group. This is all going to be your own stuff. We're not going to post this anywhere. This is stuff that, you'll send it to us, but then, we're not sharing it with anybody. It's just, it's for you guys to use to work on what you want to do. I hope that answers it. If you have any more questions, let me know. Okay,
for sure.
So,
Kay, there's one.
Go ahead. One more.
There's a couple more questions. Yeah.
Okay.
When will the groups meeting in Harrisonburg? I guess the question is, when will the groups meet in Harrisonburg? And so I'll let you answer that there.
So, and then Kathy, if you want to click in. I think I'm okay in saying this. So the next group of meetings, the first group of meetings, the Tidewater area, the Roanoke area, are going to be happening the week of April 17th. The next set of meetings is going to be happening the week of May 1st, the first week, and the Harrisonburg, that sort of Harrisonburg area is going to be meeting on the 3rd, Wednesday the 3rd. The Roanoke sort of area will be, sort of that southwestern large area down that way will be on Tuesday the 2nd, and then the Northern Virginia area will be on Thursday the 4th. So it's the Roanoke, southwestern on the 2nd, the Harrisonburg, Charlottesville, sort of that area on the 3rd, and then the 4th will be Northern Virginia.
And a follow-up question, Kay, to that is when will those groups that aren't the Tidewater Richmond area receive this particular the metrics for March?
So the goal is so can you so there's going to be an email. Yeah, there's going to be an email coming out, and I think that so the plan is that when I don't have the registration list right to get that out, but I'm working with Kathy and Nichelle, and I know that they were planning by the end of the week to send out sort of a logistic information about like the details of the place, location, and all of that. And as soon as that comes out, that either with that or right after that, you will get an email with the metrics attached. Okay.
And then I just have one last, I just want to acknowledge this next question, though I know that we won't get into this now, but this is an excellent question that we will be addressing at the upcoming workshop. So the question is, can you explain again how you interface with HUD and how the information that you're providing us helps us in terms of our operations? And I suspect that that really goes to overall program and system performance levels. So I just wanted to say that we will be getting into that in great detail, which is actually a large part and goal of this overall workshop coming up in session. So we won't be getting into that now. This is really more of a just showing you the tip of the iceberg, but when you leave the sessions, the in-person sessions, we will have explained that in much greater detail. So thank you for that question.
Yeah, and I to concur with what Chrissy said. So yes, so like all of the stuff that we're sharing has been. I mean, the Alliance has put this together, but we've been working side by side with HUD, so they have seen this and have been really given their sort of check mark of this is where the stuff that we want shelters to hear, and so we'll get into it a little bit more of how that. And actually, I'll talk a little bit about sort of how this interfaces with the larger system when we talk right now about this role of shelter in a crisis response system, but we'll get into it a little bit more. We're not, that's not the purpose of this webinar. We're actually upcoming, and I know it's going to be after the first group meets, but before the second group meets, we are kicking off an emergency shelter webinar series starting on April 26th, and the first session is a whole webinar just on the role that emergency shelter plays in the crisis response system. So I encourage all of you that are coming to the second meeting to sign up for that. It's on our website, and you can register for that. I encourage you to do that soon. We can only take so many people, and we're up to, 700-800 people that have registered for that. We just put the first information about that a week ago. And so that will be in much more detail about this, but I just thought it was important to at least do a couple slides here to sort of give you that sense of it. So if any of you came to the system design clinics that Ann and I came down and did a couple years ago, some of this should sound familiar, that there's these sort of, these like 3 areas that really make up a crisis response system. And one is sort of that coordinated entry, the access and prioritization of people getting into the system, which includes outreach and diversion. And then there's crisis housing, which needs to be immediate and easily accessible and available for anyone. And then assistance in returning to permanent housing, whether it's rapid rehousing. I think when we came and did the clinics with you guys, we had rapid rehousing and permanent supported housing as sort of 2 different pieces of the crisis response system, but we decided let's put it all together in returns to permanent housing. Remember I said we keep learning as we talk to communities, and so 3 years later we decided to make it 3 boxes here instead of 4, and put rapid rehousing and permanent supportive housing, but also mainstream public housing and other housing resources. The concept is, how people, a way that people who need it the most can get into the system. We need to have that crisis housing beds, and then we need to get people out of the system quickly. So where do you guys fit in? Because you don't see the term shelter here, but where you fit in is this little arrow comes up that you are the crisis housing, this is the role that emergency shelter plays is just so critical in the system. And I love Cynthia Nagendra on our staff and the director of our department put this slide together, and I love it. So I pulled it over just for this. So, when you think about the crisis response system, the idea is that, somebody gets in the system and we got to get them back quickly to housing. You guys are this trampoline. The emergency, literally the emergency shelters play that role of being the trampoline. So it's sort of a safe place to land, but you don't land and stay. You land in shelter, and the idea is that we want to quickly get you connected with permanent housing as quickly as we can. So again, to just sort of say that the key elements of an effective system is that effective shelter is just critical. If you're going to have an effective crisis response system for homelessness in your continuum of care or in your community, every single continuum of care must have immediate and easy access to safe and decent shelter to anyone that needs it, and prioritize the most vulnerable and aim to rehouse people as quickly as possible. And so we'll get into, as we do the key concepts of how does that happen? How do we have, how do we make our shelters immediate and easy to get into? And we'll talk about what that word easy means, because we're not going to use the word easy later. And then, and how do we know who needs it? And how do we prioritize the most vulnerable? And then what do we do to quickly get people reconnected to housing? So the system role for emergency shelter is that, again, how well emergency shelter does is so critical now to how the whole system works. And this is, also alluding a little bit to what Christy said, is that emergency shelter plays a critical role in this whole system. And this is again, where coming from HUD as well as USICH and the Alliance, I mean, we're all aligned is that we haven't looked and talked about this role of emergency shelter and how we need to make sure it's effective, which is why we've been asked to really start focusing on this, is that as you look at your systemic performance, which every continuum of care now has to report, these are the three areas you have to report on: the average length of homelessness across your system, the number of exits to permanent housing across the system, and the returns to homelessness. And so what happens at that very first springboard of emergency shelter is critical. If folks are staying in the emergency shelter system for a really long time, that's going to add to that average length of homelessness. If people are being exited from emergency shelter to places other than permanent housing, that's going to affect the system's performance on exits to permanent housing. So it's a critical role that emergency shelter plays, and it really impacts how well emergency shelter is operating. Really impacts. Shelter really matters, and we recognize that shelters just have not received a lot of technical direction and support over the years from, the Alliance wasn't doing a lot of workshops necessarily or trainings. We've done a lot on, retooling or transitional housing. There's been a lot on permanent supportive housing. There's been a lot of rapid rehousing, and so this is why it became so critical. We started saying, okay, we really need to start focusing on this. And back to what Christy said, this is again where HUD is saying, yes, we need you guys to be talking about this stuff. And so we really want to give you, in this work, to really give you the support that you need and connect you together as shelters, and also connect you with, other folks across the nation that have really made some shifts and are seeing great outcomes, so that you can, I use a term, that we can continue to do the good work you're doing, but get it even better. So the key elements that we refer to, we're going to start shifting into that, is that there's the housing first approach. The second one is diversion, and we'll talk about that because you heard me talk about that with coordinated entry, but we're going to talk about how the shelter plays such an important role there. The third one, which is huge, and this is where we change the terminology from immediate and easy access. When we talk about easy, we mean that shelters need to be low barrier. People should not be screened out because they have a ton of barriers. So people that are vulnerable need to get in. The fourth one is housing-focused rapid exit services, and this rapid exit doesn't mean we just shoot people out because they've taken up their 30 days or their 60 days, but it's rapid exits to permanent housing. And then like using your data to measure performance. Data is critical in an effective emergency shelter system. So here's your slide. Shift happens. And to just talk about this, we first used this when we started doing emergency shelter training a couple of years ago. And this has just ended up driving a lot of talk with shelters around what they're doing. And so we ended up deciding to use the hashtag shift happens. To tweet about our work. We will be tweeting out connections, things that you can do, and resources so you can, if you want to follow what's going on, and we encourage you guys to do the same thing if you're tweeting. And we just know that as we've worked with shelters across the country, this has really become our mantra. And we just want to make sure that you do recognize that, there is an S in the word. And I just to tell you how this has sort of really helped folks think about this is that I just got an email from a Connecticut shelter that we worked with over a year ago that made significant changes to their shelter. And she just said the shift, the shift was hard. But I'm so glad that we did it because it's made all the difference for those that we serve. And I just, so that's why we started really thinking about the shift happening. So there's three ways that we want to talk about this shift. There's a philosophical shift that needs to happen, there's a practice shift that needs to happen, and there's an operations shift that needs to happen. So we're going to talk a little bit today. Mostly we're going to talk about the just give a brief overview of the philosophical shift, the practice shift. Again, we're going to get into a lot more detail on practice when we come to meet with you in person. But we also we're not going to talk about the operations shift because there's always questions about operationally, like if we make these practice shifts, how is it going to affect us operationally, space-wise, and all of that. We're going to get into that in detail when we meet with you. So I just wanted to let you know that this last part, the operations shift, is one of the things we're not going to talk as much about today. So the first element is this housing first approach. So I just want to sort of say that this is a reminder that this philosophy shift to this housing first approach really drives the entire shift. While we have this as a separate element, it's like this is the first and foremost element that has to happen. And we have to have this shift for all of you. And for, a lot of you that have really looked at Housing First, talked about Housing First, what's on this slide, these principles look familiar. So the Housing First principles is that homelessness is foremost a housing problem, that the principle that everyone is ready for housing now, the principle that permanent housing is a right to which all are entitled, and the fourth one is that the Housing First principle is that people should be returned to permanent housing as quickly as possible and then connected with resources to sustain that housing. But we also know that a lot of times people just think about these principles in relationship to permanent supportive housing, and even when we did our rapid rehousing training, we talked about shifting and realizing that Housing First principles also are it's a philosophy that drives rapid rehousing. With the Housing First philosophy and the principles also drive the full shift of all the other key elements in shelter. So this next slide really talks about the embracing of what has to happen. What does this mean for your shelter? So it means that your shelter staff, the board of directors, your donors, this means a shift where everybody embraces this Housing First philosophy. And that means that everybody across your shelter, that touches your shelter, this philosophy is so incredibly important to make the important shifts in shelter. And that is to believe that everyone is housing ready, that shelters have few to no programmatic prerequisites to shelter entry, and that there's a low barrier admission policy. It also means that there's this really rapid and streamlined entry back into permanent housing as quickly as possible, and that supportive services are voluntary. So I'm already imagining some of you are sort of thinking about, okay, this could mean a big shift and I'm not sure that I'm comfortable with it, and we'll talk about that later. So as we go through and think about this Housing First philosophy, it brings me to the next key element, which is diversion. So I know, like, I can sort of already, it's amazing that this is when I wish I'd have a camera. This is why those of you who know me know that I love presenting in person better than I like doing webinars, because I like to read sort of where you are. I can sort of feel the temperature of everyone, and right now I have no idea because I can't see you, but I'm sort of imagining that already when you sort of I went over the most recent slide. For some shelters, this may be very different than the way you've currently operated. Some of this may be familiar with. But now this diversion thing, okay, so what does that have to do with shelter? And, you're probably thinking this. You've probably been thinking this since you saw it and I first mentioned it, is that, okay, but isn't diversion part of coordinated entry? That's not really the job of shelter. So what we're going to tell you is that we have learned, and again, this is something that we've just ourselves shifted in our training, and we've always talked a little bit diversion during this work that we've been doing with shelters, but we've just added this as a key element because the more we're talking to shelters that have really made this practice, and I just did a webinar for some folks in Georgia with 2 shelters that have really made a lot of changes, and they both talked about how diversion has become such a critical part of what they do, and they both have good coordinated entry. But what often happens is that, there's that first sort of point of of contact at coordinated entry, and then, if folks aren't diverted there, they're assigned a shelter bed. But that doesn't mean that a call for shelter or somebody come to the shelter door, it doesn't mean that there still is no other option that might actually be a better option, but it does need to be safe and appropriate. So there's it's not that we keep people, especially I want to say for anybody that's on the phone, that does DV shelters, is that there's no suggestion that we should be, diverting people into unsafe situations. So the conversation that you have around that is always important. And again, we're going to talk more about this at the training, but it's this real belief that, just because somebody comes to the shelter door and they fit our criteria, it does not necessarily mean that there should be a shelter entry, that there's a lot of problem solving that can happen that very first time. It's not about filling out forms and completing intake work. It's about a conversation that happens, and that belief of everybody that, at the shelter level, that there's this strength-based approach to the clients that are coming to us are the best resource for their own problem solving, and they have a lot more strengths and a lot more connections that we maybe haven't helped, or they may have not thought of or been helped to identify. And it doesn't mean that we divert and then don't do anything. It's also, we're hearing that shelters are also using at that door that there might be something that even they can offer that they've been offering through the shelter that you don't have to come into shelter to get it. It's just a little precursor to what we're going to talk about. And some of the practice shift is sort of the idea of this strength-based assessment versus a needs assessment, so that you start first saying, like, what resources do you have, and do you have family and friends, and it's a conversation instead of looking at all these needs and sort of get, because the minute you do that with somebody, they're already starting to think, oh gosh, I don't have any resources, like I have all these needs, and you start feeling just under-empowered instead of empowered. And again, I talked about this conversation that you're going to want to engage in and identifying safe alternatives to shelter and helping people to connect to community resources to avoid a shelter stay. So just a little bit about, the idea and specifically the things that are on this slide. When diversion is happening again through that systemic front door coordinated entry, we've just learned that shelter is the next layer to all of this. And so what we mean by this is that a diversion means that people are coming and seeking shelter, but we actually help them identify maybe, not maybe, but an immediate alternative housing arrangement, or possibly even helping them stay where they are if it's safe and appropriate by, finding out if there's some resources that they may need that could make that situation better. And again, that the role that emergency shelter could play is offering, maybe some services that you have that you could be offering, maybe mediation, possibly even just talking to somebody, any related services or financial assistance, so that people don't have to come into shelter to get that. again, remembering this is not about being a separate program, but it's just a part of what you do. Somebody said to me that does a lot of diversion in Pierce County, Washington, and she said, when we talk about diversion here, it's not a separate program. We didn't start a diversion program. We just said we're problem solvers. That's the role of everything we do in homelessness, and so that's what diversion is. It's helping people problem solve and think about, are there solutions other than shelter, but always remembering that it needs to be safe and appropriate for persons. I'm trying to remember not to talk too fast as well, so hopefully we're doing okay. So then the next key element, and this is just, I keep saying this is just so critical, but they're all so important, right? And that is immediate and low barrier access to shelter. So after diversion conversations indicate that our alternative is not available, it's really critical that persons in need of a shelter bed have immediate access to that bed. So sort of think of it as like the shelter is like the emergency room of a hospital. And that's what you are in the homeless system. And so when you go to an emergency room, it's not like, well, we're going to put you, on a waiting list and it's first come, first serve, and just go back wherever you came from and wait there and we'll call you in a few days or a few weeks when something comes open. The very first thing an emergency room does is they triage. They try to figure out, who needs the most critical has the most critical need, who's the most vulnerable to something, life or death happening if we don't give them a bed. And I mean, that person that is, needs it and is the most vulnerable is seen immediately. That, everything stops for that person to be seen. So while you're not in an emergency room, you're an emergency shelter. And it really means that it needs to be very immediate and quick. But then the other thing is that it needs to be low barrier as well. Emergency shelter is for those experiencing homelessness as a life-saving place for them to go while they're getting a permanent solution. And it should not have multiple requirements or barriers to entry. So, the philosophy shift is just that your shelter should be easy to access and it should be the easiest for the most vulnerable. And on the practice side, it means few to no prerequisites for shelter. No sobriety requirement, no waiting lists. It needs to be connected with coordinated entry. It needs to prioritize the households with the most need. It should have 24/7 access. And we know a lot of times shelters only operate at night, and then at days folks are expected to leave the shelter, and we'll talk more about that and how we can think about that. That sort of comes under the operations. There needs to be the equal access rule compliance, which we'll get into more when we meet with you guys, and remembering that rules should only pertain to safety. So I'm going to already recognize that this practice shift may feel uncomfortable for a lot of shelters and very different from common practice. And so that's why we're going to dig into this a lot more when we meet with you and really address some of those concerns that you have. So I want to also say that immediate and low barrier access does not mean first come, first serve. And it doesn't mean that everybody calling needs a shelter bed. Remember diversion. And it doesn't mean like waiting in line to get the next bed. The idea that, it's 9 o'clock, people, get in line and, and once the beds are filled, then that's it for the night. And it also then doesn't, that idea that it's immediate access, it doesn't mean more shelter beds. What it means is that how can we as shelters come together and learn together to just be, more effective with what we're doing so we can help more people in a more positive way. So what it does mean is that you're serving people using substances or with mental health disorders regardless of their treatment compliance. What it does mean is that you serve people with criminal histories. What it does mean is you're implementing the equal access rule, that you're serving households of any configuration, including couples without children, as a household, not as separate persons, as persons identifying as LGBTQ and even youth, if you're a youth shelter, two-parent households, moms with teen boys, sort of all this stuff that, because I used to run a shelter for women and children, and but we wouldn't take boys over the age of 11, and under the equal access rule, that's just not an option anymore. You know, if you serve whatever the configuration of family is, and again, we'll talk more about that. So the question is, are you screening in the most vulnerable? Are you screening out the most vulnerable? That's the question that we'll be talking about and asking you guys over the next several months to be thinking about. So one of the things that I often hear is that shelters will sometimes talk about this stuff in programs is, you know, things like, well, you know, we just can't keep this person anymore because of these things. So a low barrier shelter does not require folks to have income at entry or be employable and show that they, you know, have a way to be employable or get some income. And it should not be this idea that, well, folks need to exhibit a desire to change to come into their shelter. They have to have a good attitude or be cooperative, do you like that? I made up that word, cooperative and engaging, or they seem motivated. It really means meeting people where they're at, because folks that have been out in the streets the longest, folks that have a number of issues that's led to, you know, long-term homelessness, so those, you know, vulnerable people probably don't have a good attitude. You know, I wouldn't have a good attitude if I'd had to, you know, been sleeping outside for a number of years and have dealt with numerous rejections. And I don't know that I'd be that cooperative and engaging or feel very motivated. But, you know, the idea is that we bring you in and meet you where you are and then get you to believe in yourself again that something can happen and changes do happen. Shift happens. So then the next key component is housing focused and rapid exit services. So housing focused philosophy means that from the moment someone enters shelter, the philosophy is that they are ready to be housed immediately, and that housing plan for that individual housing plan to a rapid permanent housing exit starts at the very first contact at the shelter. The very first conversation, and every conversation from then on out is housing focused. Everything that the shelter does offer, everything the shelter does internally and does for their clients, everything is focused on housing. So it's everything from the environment, the meetings you have, whether staff meetings or meeting with residents, the policies and procedures, job descriptions, you name it, everything reflects a housing focus. And we're just going to talk a lot about how you can incorporate this at our meeting and have you guys actually, you know, start thinking through ways that you can do this within your own shelter. That's sort of, again, on the operational side. So one of the things, again, I said this before, and I just can't say it enough, I want to clarify that rapid exit does not mean that we dismiss people back into homelessness, you know, at the end of a certain time period, like 30 days or 60 days. It means that our goal should be for folks to move to permanent housing rapidly and exit to permanent housing rapidly. You know, it'd be great if everybody could exit in 30 days to permanent housing, but it doesn't mean that there's time limits and that we just exit people back out into homelessness. And we'll talk more about that as well. So, you know, while we're going to work on ways to make this practice shift in our meeting, here are just some ways that I decided to include this slide to help you start thinking about some of this as you get ready for the meeting. Is that, again, that rapid exit to permanent housing starts at the shelter arrival. And things like, you know, I hear all kinds of terms for, you know, like it's a, you know, a family plan or a case plan. And one shelter that has been part of some of the work we've been doing had an empowerment plan. And, you know, it's like, it should be a housing plan. You know, you start calling the work you're doing a housing plan, and it just changes that shift in that focus. And it's about identifying just barriers to housing, not all the other stuff, but the barriers to housing, and then what has to be done to address those barriers to help you move quickly into permanent housing. And every in-person meeting is about a quick move to permanent housing. You know, it's not about rules, and it's not about, you know, house meetings, and it's it's, it's not about attitude, it's about moving to permanent housing. Not that those things don't end up getting talked about, but it's in the context of permanent housing. And there's just this clear housing message throughout the shelter, and that, for each person, that in some format that there should be some discussion about the housing plan weekly with every person that's residing at your shelter at a minimum. And then this rapid exits to permanent housing, just that practice shift on this rapid exit side is just reframing your message. It's really important about how we message. And, one of the things I often say, well, we want to make this home-like environment for, folks, and we want them to feel welcome. And I'm just going to suggest that, shelter is not your destination. It's just a step to get you housed. And our goal is to get you out of here quickly because, we want you to have your own place. We can rapidly rehouse you. And let me actually say, the reason it says here we're going to rehouse you rapidly is that even without rapid rehousing, internal programs, shelters can still find ways to do this. And just that belief that we know you can be housed, because if you don't believe your folks should be housed, obviously they're not going to believe that. So this is some ideas on messaging. So again, the question you should be also asking is, are there services or requirements that we have that are really slowing down this rapid exit to housing? Are there things that we can eliminate, or are there things that can take place after housing is obtained? So, just to sort of get your thoughts flowing in the direction that we're headed in. So I don't, Christy, is there anything that's come in that's pressing that before I do this final component? I just wanted to take a little pause because I've just been talking a lot.
Kay, there have been a few questions, but most of those questions have been about how to operationalize this guidance into very, very specific questions about low barrier, whether that's related to support animals or immigration or other safety and security of the staff. So I let folks know that we won't be getting into the nuts and bolts of that kind of operationalizing this this guidance, but that is exactly what we're going to get into in the session, so folks are aware of that. Other activity on the question board was poor Fairfax County had a tornado alert and had to shelter in place for a few minutes during the call, so they're back, so glad to hear about that.
Okay, and did you hear my gasp? Like,
yeah, right, exactly. So, but everybody's safe and sound. So I think the only other thing to note is we've had some participants just express, that this feels a little bit like drinking from a fire hose, and I think we understand that sentiment very much. But again, this is just an introduction of information, and we will be getting into the step-by-step kind of implementation of this guidance at the upcoming session. So we know it's probably a lot to take in right now, but we want to give you time to get a sense of what's going to be coming up, time to digest that, and then jump into it once we get into the upcoming session. So I don't think that we have actually any very specific questions right now that aren't really getting into the nuts and bolts.
Great, and what a great summary for that, Christy. And you just hit it on the, hit the head on the nail on the head. Yeah, that nail on the head. Got to get that right. I want you to remember again, we're not coming and just doing a session and walking away, right? This is a process, and that's why the folks at DHCD asked us to come in and be part of this and walk beside you over several months. And a shelter from Connecticut that participated in something very similar a year and a half ago was just on a webinar the other day, and she said, and this is what we'll probably do this for you guys too, and she said, this is a process, and that was what was so nice about this, is that it wasn't like we showed up and it's like, okay, by next week, you need to think about this. She said there was just that support, and it's like, it's a process, and you start with where you can. And she said that there were just some really quick things that we could do immediately, and all of a sudden that just had an impact. And the other thing is we found there were things that we were really worried about, and then we tried it and we went, oh, why were we worried about that? And so just recognizing that, and that's why you heard me say, as I shifted some of these slides, I'm sure if I could see your faces, you would be going, okay, clutch my chest, like what are you guys talking about? And so that is why we also broke this up into 5 learning communities and didn't just have one big meeting with tons of people. We wanted to keep it small enough that, you know, you guys will have time to really talk about things, that we can reflect on things and really have ways to think through it. And by the way, I just want to say that the monthly calls that we're going to have is not going to be a monthly call with all of you. Each learning community will have its own call, and so that, again, it's a small enough group that you'll be able to talk about it with each other. And, you know, because I don't know about you guys, but when I'm, you know, on something with 100 other people, I find it really impossible to get much out of it. So we want to, you know, keep it to a smaller group of shelters that will be participating in each one of them.
So Kay,
so
just
I don't know.
Actually, Kay, just want to say, just to
Yep.
To piggyback on that, we did have a question from a participant saying that you had mentioned weekly meetings and wanted you to expound a little bit more on this, but I just want to clarify that I think you meant monthly calls, not weekly meetings.
Yes. So we're going to have monthly calls. One of the things that we're saying in terms of internally in the shelter, we just found that the shelter teams that sort of touch base with each other, just even have lunch together maybe for half an hour, one day a week, just to say, how are things going? Or, you know, we even heard somebody say they just, like when they, you know, when the team is all together, like, you know, maybe if they show up the same time at a certain day, they just start out their day. You know, if there's not like some major crisis, like they'll just say, okay, Thursday mornings, we're just going to touch base and talk about some of the changes we made and how it's going. And it might be as just a touch base. So we're just saying we encourage you to touch base weekly, right, with each other. And if it's not, at least bi-weekly. The idea is that that's not with us, right? There's no meetings that we're going to have you guys come to or any of that. It's just within your own shelter team that's sort of working on some things. We find that the feedback we've gotten is by the shelters coming together and doing this as a team is that I just heard this from a bunch of Georgia shelters the beginning of March. We were down there and they just said, we have gotten so much better as a team because we just weren't talking to each other much anymore, except to get together and complain about stuff, like, you know, like if there was a crisis or an issue. But when we shifted this to talk about like all this stuff, it just made us so much better, and like we actually know each other so much better now. So that's, again, a learning process, but, you know, we're not telling you have to do that. It's just a suggestion. Does that help, Christy?
Yeah, I think so. Thank you.
Okay. So I also want to say that I just got I saw a note from Nichelle with DHCD that there will be an email that will go out tomorrow. I think I got that right. Okay. So now this last thing is data, right? So we're going to do a poll. So Christy, you want to do the poll?
Yes, great. Thank you, Kay. This is just a quick poll to have you all start thinking about data, the importance of data and collecting the data. And so this is the type of questions we're going to ask. I'm going to launch the poll now. And if you could take a few minutes to answer whether or not what your data might have been in fiscal year 2016. It's not supposed to say wow, it's supposed to say how many of your households exited to permanent housing within 60 days during fiscal year 2016. And voting has begun.
Christy and I get to watch the percentage go up.
Yeah, it's great. We're about 70% of folks have answered, and we're about 20 minutes to the end of 20 seconds to the end of the poll. And we're up to 75%. Thanks, everyone.
You guys are good. You guys are good participants.
Yes. Okay. I'm going to go ahead and close the poll at 80% participation. 1 second, and I'm going to share. Okay. So it looks like.
So I'm not seeing it on my screen, Christy.
Oh, you're not?
I don't know if people can see it.
Oh.
But.
Let's see. I'm seeing it here. Well, let me just read what it is. So we've got 13% of households exited to permanent housing within 60 days. 0 to 25% was 13%, and 32% exited within 60 days. And then 29% exited within 60 days. It looks like the participants can't see it. Someone just said that. And we have 11% of households who exited within 60 days at 11%. 11%?
No, 11% said, so 11% said that
Yep.
about 75% or more of their folks are exiting permanent housing within 60 days. Yeah.
Yeah, sorry. Thank you for that. And then we have about 16% of participants who don't know what that data is. So this is very helpful, and we'll be able to really get into these numbers in the next couple months. So this is very exciting. Thank you for participating.
So, so here's the reason we said this, right, is that, you know, and you may have taken a guesstimate, you know, and some of you didn't know, and, you know, and the reason we did this is that it's important to know where you are, right, and that sort of brings us to the metrics, because regardless of where you are, you know, if you're in that group that said, you know, that 11%, which was a small amount that said, you know, while 76% or more of our folks are exiting permanent housing within 60 days, you know, like that's awesome. Like that's really good. But, you know, but is there still something we could do? We're really doing well. Is there something else? You know, if we shift this, maybe we could get even better. You know, for folks that are under 25%, that's, you know, a low number. That was about 13% of you. So about the same, you know, amount, a small amount are seeing that happening. And you know, so, you know, we want to get that up. But, you know, this is a starting point. Like we're not going to, when you come, nobody's going to say, oh, like, look where you are. Like, again, this is your own stuff and this is your starting point. And so, okay, so this is our starting point. So you have to sort of know your starting point to know where you want to go. And the whole thing is like, you know, let's come and know this, which is why we're going to have you send them March metrics, because ultimately this is the stuff that, you know, you need to do. So historically, and look at me, I have to page through some stuff here. So when you would talk about data and performance, this is not about reporting the number of beds you have, the number of beds that are filled, the number of nights of shelter, your capacity, the number of meals served, the number of case management contacts, the number of volunteers, the number of meetings held. Like we know that that's often stuff that the shelters are asked to report on, but ultimately it's like, I remember somebody saying to me, you know, in this whole, you know, the Logix model, for any of you that have worked, you know, worked under that model, you know, the Logix model, you had outputs and you had the outcomes. And the first time I went to a Logix model training, somebody said, so, you know, you guys have been reporting to all this stuff, you know, like we had this many clients and, you know, we did this many meals, and they go, but so what? Like you could do all that stuff, but ultimately this is about ending homelessness and shortening the length of time people are homeless and getting people into permanent housing. So that stuff is great stuff, and because you're doing that stuff, you know, folks can have success. But what we need to be focusing on is, you know, are we decreasing the length of time that people spend homeless? So, you know, and again, the exits to permanent housing in under 60 days, not our exits in 60 days, which is a difference. And it's increasing our exits to permanent housing while decreasing that length of time that people are in our shelters. So those two things have to go together. And then also, you know, we know that when we're not exiting people into homelessness and exiting people into housing, that the returns to shelter go down. But if somebody's in a shelter and we're exiting into homelessness, they're going to show up at another shelter. So now we've got to return to shelter again. So again, trying to keep those returns down. And then this is the big one, is that we want to decrease the number of people being asked to leave shelter because of breaking the rules, not participating in mandated services, or timing out. So that's a lot of the stuff we're going to talk about, is like what shifts can we make to make that happen. So just again, this little, you know, that's why we're focusing on these. So if you look at the kinds of things we're looking at, is, you know, exits and exits to permanent housing, and then average length of stay for all exits, and the average length of stay for exits to permanent housing destination, and then the stayers, you know, because the exits only tell us one thing, but what about the folks that aren't staying? We can have, you know, sometimes the exits to permanent housing are in a very short time, but then we look at the stayers and we end up, you know, over, you know, half of our beds are filled with stayers and they've been there for 5 months. And so how do we start focusing on that? And we learned by asking this stuff that people started really going, wow, like we haven't really focused as much on thinking about that. So that's what we're going to be doing, and it's just going to help you to sort of think about how you do this. So here's the other thing I'm going to tell you, is that we have just learned that, you know, the elements that I went through that you're still sort of, you know, feeling a little bit overwhelmed by in some cases, we've learned that as some of these key elements are adopted and the shift starts happening, that this stuff automatically just starts getting better. It's like it's just a connection with, when we become housing focused and start talking about housing at the front door, and we start really focusing on strengths and identifying resources people may have, and also not making people feel like, they can't be comfortable in our shelter because of a lot of the rules and that kind of thing we have. We just find that these, the exits to permanent housing end up going up and the time length of stay end up decreasing, and the shift just happens. So, summarize, we're almost done. Ultimately, shelter and the role I just can't say enough how important you all are and how much, that's why we're so excited about, all of you, participating, and your questions have been incredibly good questions. It's the right questions to be asking, but how, and then starting to think about how we become a better springboard back to permanent housing. And again, thinking about how can we be that place and still be safe where the most vulnerable land, but also are quickly returned to housing. And also be thinking about how we can exit more households to permanent housing while shortening the length of stay, because ultimately if we do that, we're going to reduce homelessness and we're going to help more households. And that's what you all are about. Like, none of you are doing this because, you're getting that big paycheck and, have, like an easy job. This is incredibly hard work. The stuff that you guys are doing is really, really hard. And I know that, and I want to recognize that. And, but you're doing it because you want to help people. And what we found in just, working with some of the shelters that we worked with is that, we've had more positive exits from shelter, and at the same time, more homeless households are getting to come into shelter, because if we're exiting people to permanent housing more quickly, we're able to help people that are waiting outside, living on the streets, living in encampments. We can bring those folks in, and then we can start reducing homelessness. So finally, whoops, went the wrong way. Let me go back. So finally, just remembering that shift happens and that we are learning together in a changing world. And, especially some of you, I've been working with some shelters in the last year, who have been at their jobs, as executive directors for 20, 25 years. And we just all recognize that homeless services have shifted so much. It's a changing world, but if we can come together and learn together, it just makes shift happens so much better. And so the hashtag is there, shift happens, that you can be following it. So any other questions? And I don't know, can you unmute Kathy and Nichelle and allow you guys to say something as well?
Yeah, 1 second. Let me just go ahead and do that. Actually, Kathy and Nichelle are unmuted. And we do have a question, Kay, when you're finished.
Okay. So I don't know, Kathy and Nichelle, do you want to just jump in here and say a little something? I'm not hearing them. Maybe they muted themselves.
Possibly.
Can you hear us now?
How about now?
Sure can.
Yes, we can.
Okay.
Yes.
All right. We just want to thank you for the webinar, number one, and also we are just so excited because we do recognize the critical role that shelters play. And I think that, as we go forward and our funding is really allocated and awarded on a community level and with a community approach, the role of the shelter is, again, critical to that. And the standards of being low barrier and housing focused are something that, we take into account. And so it's going to be increasingly important. And so we're really, really eager to work with you all on this, work with the Alliance and all of you out there on this. And so, and also to say that, this is not about finding out, if anybody's doing anything wrong in their shelter or anything like that. That's not what this is about. This is about us learning together and moving forward together. So, Nichelle, did you?
No, we're looking forward to this, to being able to have these sessions with you all because there's a lot for us to learn, and I think it's a lot that we can gain as the Commonwealth to move everybody forward and get in the house.
Great. So yeah, and thank you. And this is what we also can't see, during a webinar is like as Kathy's talking, I'm like shaking my head, and the idea that, yeah, I mean, well said, Kathy. This is not about like bringing in and saying, oh, you're doing everything wrong. It's just about like, okay, and just giving you support and just recognizing that we've done tons of training for other stuff, but we have not reached out to the emergency shelters, and this is a time that we want to do that. So what other questions? And also, if there's any, logistic questions for Kathy and Nichelle, and to sort of think about the role that we're playing right now is that, like we're the content leaders. Christy and I are the content people from the Alliance in terms of the information. DHCD, Nichelle and Kathy, are sort of the logistic and in some ways the operational, how to make sure that these communities come together. We are actually, just to let you know, we'll be meeting with the DHCD staff the same week that we're in Richmond and the Tidewater area. We're actually going to be meeting with them during that period of time, and that one day, and actually just sort of talking about and giving them training as well on just ways that they can really support you guys in your work, so that as the Alliance moves away, when we're at the end of the learning community, as the Alliance moves away, the staff at DHCD will just be there to continue to provide that role and that support to you guys. So questions now, back to Christy. We actually took the webinar to 2:30, so it's only 2:15 right now, so we have time for more questions if you want that, but we also can end early. So I know that you said there was at least one question.
There is. Right, Kate. Someone wanted to ask if you could expound on what you meant by a unique household.
So, okay, so a unique household would be, so in a given month, let's just talk about a family shelter. So say and I'm going to just go with small numbers because it makes it easier for me to explain it. And again, remember when you get the metrics, there are some guidelines. There's 2 more pages that go with them that sort of give a definition. And that's the other thing is feel free. Those are the kinds of things that either Christy or I, we will give you our email. So if you can't reach one of us, reach the other one. We will give you feedback, and help you if you have some questions. So let's say you're a family shelter that can serve 10 families. You have 10 family units, and so however those units are, whether it's a room per family or an apartment per family, but I don't think most shelters are apartments, but say you have 10 family units, right? And so at the beginning of the month you have 9 of those units are filled. All right, so at the beginning of the month you have 9 families, and then 4 families move out, right? But 5 move in because you had 1 empty room, and then as 4 families move out, 5 move in. So you would add that together. You had 9 at the beginning of the month, and then you had 5 more that moved in. So you served 13 different families that month. But then we'll know how many were new and how many exited because you're going to answer that in the other questions. Did that make sense to you, Christy?
Yes, Kay, it did, and we'll give folks a chance to chat a question or send a question if they have any follow-up here. But yes, that made sense to me.
So even if you only could serve 10 families at a time, in one month you may serve more unique households because you have some households that are going to exit and some that are going to come in. So that number just shows like the total. But we can't see that if you just give us your entries and your exits. We don't know about we can't see that, so that's why we asked that particular question.
And we actually do have a follow-up question regarding unique households, so I'm going to go ahead and read it. So regarding a unique household, if we are a single shelter, say our capacity is 40, so normally that would constitute 40 unique households. But what if a couple is married? Would our 40-person capacity shelter have 39 unique households?
Yes, that is correct. Right, and that does happen in single shelters. So yes, because under your beds, we're going to you're a 40-person bed, right? But what we want to sort of know is how many households are we serving? Because in a household we're the goal is to serve them together as a household. And by the way, I'm going to tell you, if you're a shelter and you have a couple and you're serving them together as a couple, thank you for doing that, because we know a lot of times couples end up having to be separated. So we're really happy to know that there are shelters that are not doing that and allowing couples to stay together, whether married or unmarried. So yes, that would be a unique household. So it would be 39.
Great.
Good question.
And I think
Any other
right now,
questions?
I think that's all the, well, that's all the questions we've had come in here. We can maybe get
Perfect.
those, yeah, so I think
Well,
that's
and
it
I'm
for
sure
now.
you'll have more, but that's why we're coming. You're going to see us soon, right? We're going to be, I actually think I have one more. There we go. So that's all, folks. You love that. I showed it to Christy yesterday, and she agreed that I'm allowed to put that one on. So that's for today, right? But that's not all. This is just the beginning. So it's the end of the webinar, and I'm sure that by the time you come and see us face to face, we'll be prepared that you'll have a lot more. But again, this recording and slides, we will get that link together, and we'll get that out as well. So if there were folks in your staff that could not join the webinar that you'd like them to, and I know DHCD is going to make this available to people. They got some emails for people that were not going to be able to join the webinar today. So we'll get that out as quickly as we can and work on that. So look for an email with the registration for the upcoming. So Nichelle, are you going to be doing, and again, you may be muted yourselves, just one more quick question. Are you going to be doing the email for registration for both of the meeting, for both of the weeks that we're going to be there, or are you just going to be doing it for the week of April 17th?
It's going to, and most of our folks are used to our registration. It's going to have all 5 listed, and they're going to have to pick the appropriate one, and we'll resend out the information to show them which one they're scheduled to go to.
Yep. And I just had an aha moment as you said that, is that Kathy's staff did such a great job of, Erin put a map together sort of showing which region you were in so you could sort of see where everybody is, and I totally forgot to put it in this presentation, but we will bring that with us so that you can see where everybody else is, and like what the, so each one of you will be able to see. So before we send this out, we may go back and add that as a slide, or just send the map slide with it so you can sort of see the different regions.
I was wondering what, this is Aaron. I was wondering what happened to my map.
I'm so sorry, Aaron. Like, literally, the minute Nichelle said that, I'm going, oh, crap, I did not put the map in. So, Aaron.
After I asked him to hurry and do it yesterday.
I know, and I got it, and I was so excited when I opened it up and saw it. And so, oh, my gosh. So all of you that know Aaron know that he'll give me a lot of problems about this. So I'll owe you something, Aaron. So, all right, so that's it. Thanks, everyone. And I'm so excited to see all of you in person, and we'll be there in less than 2 weeks. So thank you. Bye-bye.
Thanks, Kay and Christy. Thank you.
All right.
Thanks, everybody out there.
All right, thanks. Bye.